Good morning. I'm Liz Bankovich with the Buffalo Niagara Partnership. Thank you for spending the next hour with us. School is back mostly. There's so many different models from hybrid to full remote to in-school instruction. Today is all about what employers need to know about paid leave. A few housekeeping things. We have a few services at the partnership that I would invite you to look into. If you go to our website, you will see B&P Business Link. This is an opportunity for you as an organization to ask any question that's on your mind or the minds of your coworkers. It could relate to HR, legal, marketing, safety, IT, anything. Any question regarding how to run your business or how to run your business unit, all you do is simply submit your question online, and we have a host of member experts that can answer that question for you. We encourage you to do that. That is running at all times. We also have COVID-related resources on our website. We have business bulletins since March that are all published. We also have recorded webinars on a host of many different topics. So you can take a look at those and you can download them, and the information is very relevant and current. The last thing I want to talk to you about is It's Our Job campaign that we launched on Monday. It really means us doing our part to keep Western New York bright and vital. It's all about shopping local to keep local businesses open. And it is about curbing the spread of the virus by social distancing, washing hands, and wearing a mask. We have lots of free, cool tools for you. And all you have to do is go to our website and you can download some of those tools to help you keep our Western New York open. So let's start. And I want to say that today has really been made possible by Liz Warren, who is the Executive VP and Chief People Officer of ESC. Many of you may know Liz from some of our past webinars. And I'd like to introduce Rob Weisflock, who is Partner Labor and Employment Group with Harder Seacrest and Emory. Let's get started. What is FFCRA?
Oh, I think you want me to take this one, right?
Yes.
So if you think back to March, what happened is all of a sudden we heard about coronavirus and that it might take 14 days to show some symptoms. And of course, schools immediately shut down, sending people home. So eventually Congress got its act together and passed the FFCRA, which provides for 2 weeks of paid leave if someone has symptoms or is forced to isolate or quarantine, or if their son or daughter's school closed down. And then it also included an expanded provision of extra FMLA leave for someone's school who had closed down and their son or daughter was now unable to go to school. So you've got 2 weeks of paid leave and then actually another 10 weeks of paid leave if someone's son or daughter needs to be taken care of because their school is closed. And that's in place until the end of the year. And obviously now with schools opening up partially, that's why we're here to talk about how the FFCRA works. Or doesn't work in some cases.
Yeah. I want to also tell our audience that we're going to go through a series of 10 questions that Liz and Rob will be answering. I would encourage you to submit your questions in the Q&A function. If you look at the bottom of your screen, you'll see Q&A. You can type in your question. We'll have about 10, 15 minutes at the end for Rob and Liz to answer those. So I would encourage you to type them throughout the presentation and we can get those answers for you. Thanks, Rob. Kath, next slide. So this is for Rob and Liz to answer. How does FFCRA leave interact with hybrid school models? What if my employee's child's school is 100% remote or partially remote and they do not have childcare available? You can start with that.
Well, I think that this is such an interesting question and one we're getting every day, multiple times, because school's getting closer, of course. And one of the things you have to first look at is, has the person already used their 12 weeks of leave? Because many people have already exhausted that leave as school, as Rob mentioned, ended in March, really, for almost all people. So you first have to look at that. And then you have to look at, what does school being closed mean? So the interpretation of that has been, if the school is closed to your particular child, even though the building might be open to other children, it's pretty much closed. So if you're on this hybrid model that a lot of schools are on, where your child goes to school on Monday and Tuesday, and then Wednesday the school is closed, and then Thursday and Friday they're working remotely, while they are not in school on Thursday and Friday, school is deemed to be closed to them. And so the employee may be eligible for FFCRA at that point to cover. I thought something that was also interesting with this is intermittent coverage. And that's what a lot of employees are asking, can I use this instead of being out fully? And now they can. I think originally the DOL said no, but and I'm sure Rob can speak to this, a federal court overturned that and suggested that, yes, employers do not need to give permission. It's really the employee's choice.
Yeah, and that originally the regulations said that the leave can be taken intermittently if the employer consents. And of course, a lot of employers said, why would we ever consent to that? Because it's very disruptive. But then the court said, well, that doesn't make any sense. If the leave is available, why wouldn't you allow it to be taken intermittently? You shouldn't allow employer consent, which does make a little sense, because if you think about the leave for childcare portion of this, it goes up to 12 weeks and it's part of the FMLA, and the FMLA has never required employer permission to take FMLA intermittently. So why would you require employer consent for this additional FMLA leave? But it is certainly extremely disruptive because you don't always know what's going to happen with the school. Like right now, my kids are going to go back 3 days a week and remote 2 days a week, but that could change next week. It could change tomorrow. And then suddenly your entire leave structure is messed up.
Another part to this question, Liz and Rob, what if my employee had the option to send their child to school but opted instead for remote instruction?
Yeah, we've gotten this question recently. We think the answer is the school is not closed to them. They have chosen, probably for good reasons, but they have chosen not to send their child to school, so they wouldn't be eligible for this leave. Now, you might be able to work something out and have the employee work remotely, but if you can't, then either you give them unpaid leave or you might have to make a more drastic decision.
Yes.
We've been having lots of conversations with our clients about this, is what do you do if this happens? Because the school is open to them, so they're not going to be eligible for the FFCRA. We believe I think there's not been direct guidance from the DOL, but from everything that we can tell, I agree that they wouldn't be eligible. So we've done some creative things with some of our clients. We have an IT professional who is going to be, has some young children. The daycare was still closed, and it was going to be taking care of them for part of the day while his wife is at work. And so what he is doing is working from 9 or 10 o'clock to 1 or 2 to be available to clients when he's client facing. But then he agreed to do programming between 9 p.m. and either midnight or 1 a.m. And so that worked. It was a win-win. It worked for the business. It worked for the employee. Now, I realize that's not always going to happen. Not everyone can work remotely, but there are other things that you can do. I don't know if people are familiar with 211 Western New York, where you can just dial 211 on your phone, and you have resources available to you. So it's kind of like social service resources, and they connect people to agencies. And one of the things that they help with is childcare. So you may be able to call and say, this is my situation. Is there some, childcare facility that's near my home? I have heard of some childcare facilities that typically only took very young children, having a more intensive kind of after school or remote school care. So you may want to think about that. I've also heard from another client that there's a group of parents getting together, and it's 4 parents, and they are going to each work from home one day, and they're going to supervise the remote learning of some like preteen type children that maybe can be left alone. They're right on the edge of that, but yet they need a little motivation to stay remote with their schoolwork. And so the parents got together and made that alliance. So you do have to think out of the box for this situation.
Yeah. And going back to something Liz said right at the beginning, it's very important that we understand that the first 2 weeks of paid leave for various reasons, you get once. It's only once. You can't repeat it. Let's say you're subject to an isolation order and you take the 2 weeks off, and then you have symptoms 3 months later, you don't get it again. It's only once. And then the rest of the leave is part of the FMLA. So if someone within the last year had a child and took FMLA for bonding and recovery, and they used up their 12 weeks, they don't get any of this additional FFCRA childcare leave because they've run out of FMLA time. So you need to track all the reasons someone has taken FMLA leave over the last year, essentially, whatever your leave year is, to make sure that they're only getting the 12 weeks of leave. So some people may be in the exact same position as the employee next to them with a school closure, but they might not have this benefit.
Oh, okay.
Remember, employers get tax credit for this at the end of the year. So documentation is really important as well. So, some of the documentation you want to consider when you're approving this kind of leave is obviously, what is the employee's name? What is their child's name? What school or daycare center did they go to that is closed on certain days? Why do they need this leave? We've also got the question of, what if there is both parents at home and they both want to take leave? Well, the FFCRA says that is not what it is meant for. So it is not meant for 2 parents to be home with the children at the same time. But that can be a sensitive conversation. I had one recently where the business owner said to me, I know this person's spouse doesn't work, but yet they're asking for this leave. And it's not because anyone's ill. How do I have that conversation? So my advice is very sensitively, because you don't want to just assume that person didn't get another job or get a job at that point. But I think having interactive conversations with your employees and open communication and a lot of transparency would be my best practice recommendation.
Very good. So next slide, Kathy. What parameters are there for people who are able to work from home but say they can't because their children are also home? Who makes that determination? And are employers obligated to provide leave in that situation automatically, or can an employer approve a flex schedule, other options? So probably, yeah, Liz.
I think that really important that the employer obviously, or absolutely, I should say, can approve a flex schedule. So the more creative you can be, and if the person can work remotely, then they're actually not even eligible for the leave if they can work remotely. But that's I guess a definition. Can they work? Well, it's very different if you have a 13-year-old who you're supervising at home while you're working, or if you have a 2-year-old and a 5-year-old who's starting kindergarten. So I think that it's very important to have those conversations with employees so that you can find out, are they actually eligible for this leave or not? And I think you determine it together. You determine it by an interactive conversation. And we have seen that employees are eligible when they have to be caring for their child. If you have a newborn and a 2-year-old and a 5-year-old at home, it's very hard to work remotely. So try to get those flex schedules instead, but if not, you may need to grant the leave.
Yeah, and there's, you actually have some data in some circumstances now, because some people have been working remotely for 4 or 5 months now, and if they've been able to do it for 4 or 5 months with their children, in most circumstances, you would suspect that things haven't changed and they could do so moving forward. But you have to allow for the possibility that there might be some circumstances where some assistance that was available in the past isn't available now, and it becomes more difficult for them. But at least with some employees, you're going to know now whether they can work from home and still care for their children.
Very good. So next slide. Can the leave be used different days, week to week, if the student's schedule varies week to week?
This one's clearer now than it was before. Like we mentioned before, leave for this school-related leave can be used intermittently, at least for the time being, because of this lawsuit. The DOL might change its regs along the way, but right now, I think it makes sense to allow the use of this leave intermittently. Hopefully you can map it out as far in advance as possible, at least based on the information you know now, understanding that it could change, just like FMLA for someone's health condition can be taken intermittently, but sometimes it changes. Sometimes they need 2 days a week for chemotherapy or something like that, but then it changes and it becomes 3 days a week. Or it's just like any other FMLA situation, which this is. You have to be flexible and grant the leave to which employees are entitled.
Okay, very good. Next slide. Liz, I think this one's for you. Employees tell me about exposures to COVID that are indirect. Are they allowed to work? Do I need to send them for testing?
This is a question we're getting all the time, and especially even directly from employees who are calling us saying, I can't work because I had this exposure to COVID. So you really have to have a good conversation with them and ask them, well, what was your exposure? So were they exposed to a person who had a positive test, or with someone who is exhibiting symptoms? That's a very different situation than someone who says, my coworker had a party this weekend and she had someone at the party who then called her and told her that her friend that she works with is out of work and has some COVID symptoms. And so there's, 3 people removed. So only if the person, spent 10 or more minutes within 6 feet of someone who had a positive test or lives with someone with symptoms. Otherwise, nobody would be working, right? If you think
Right.
about it, everybody has been exposed to something. Even if you go to any of the local stores to shop, you're going to have some exposure. So we want to be careful and certainly want people to stay home from work if they are ill and exhibiting any symptoms of COVID whatsoever. But if they've had these indirect exposures, it is okay for them to work. Now, can you send them for tests? You can, as long as you're consistent in doing that, and you're not only doing that for certain people or certain classes of people. But most organizations that we're dealing with are not sending people for testing. Instead, they're doing a screening questionnaire. Certainly, if they're an essential business and the person is traveling to one of the states that's on Governor Cuomo's list, then yes, they're testing when they come back. But it really is individual circumstances. So it's a lot of individual conversations. But don't let your employee talk you into they don't have to work when someone 4 people removed has had the sniffles.
Okay, very good. Next question. This is for both of you, Liz and Rob. How does the New York travel advisory quarantine work? Could that be FFCRA leave? What about essential workers? What happens if an employee returns from vacation and the state they went to is added to the travel advisory list the next day?
Yeah, so this one's really interesting and is wreaking some havoc with our clients. I think everyone's heard about the list, and states come up on and off the list every week depending on certain metrics that they're hitting. I canceled a trip to Alaska this month because Alaska was on the list, and they came off the list yesterday, which is the day I would have been returning, so I would have been fine. So I lost my chance for Alaska. But the interesting thing is that New York immediately said, if you go to one of these states and come back, and you're subject to this 2-week quarantine, you're not eligible for the New York 2-week COVID leave for larger employers. Unfortunately, the federal law simply refers to a quarantine or isolation order, and clearly this New York State order falls within that section. So at least for the time being, until we hear otherwise from the Department of Labor, we've been taking the position that FFCRA leave does apply to this New York 2-week quarantine, even if the employee chooses to go to Florida, for instance, or one of the other states on the list on vacation and comes back. That doesn't make anyone happy, but until the DOL says something else, the leave is available. Now, the leave is not available if you can make telework or remote work available to the employee, or if they're an essential worker, there's actually protocols for having an essential worker come back to work that are built into the travel advisory. So there's ways to avoid just having someone sit on the sidelines for 2 weeks, as long as you're an essential business or you can make remote work available.
Okay.
We've also, Rob, I don't know if you've had this question, but we've had the question, what about an essential worker who's not out of state to perform essential work, but rather on a personal vacation? And we've treated that as that is not essential work because they weren't performing essential work, because they can't get tested and come back to work. They'd have to work remotely for those 2 weeks. They're able.
Well, yeah, I mean, the law is a little unclear on that, but really the question is not what they were doing when they went out of state, but when they come back in, if they're going to do essential work in New York, I still think those guidelines apply. They're not written, the guidelines for essential workers are written as if an essential worker is coming from Florida to work in New York, but the same rules should apply to a New Yorker returning from one of those states and needing to work. And their typical protocols: get a test within 24 hours, wear a mask, stay away from people to the extent you can, and then when you're not working, don't go out in public. So you still are restricted somewhat.
Sure.
But the law is not written very well in that area, so it's subject to a lot of interpretation.
And if it is added after they return to work, that's okay. They can stay at work.
Yeah, it matters what it matters what happens on the day you come back. And not even, here's the weird thing, because this happened with the guys coming back from Alaska that went anyways. I didn't go. They came back. Alaska was taken off the list the day after they returned, but the numbers were below the line on the day they returned. And the way the law is written is, what are the numbers on the day you step foot back in New York? Because the list is only updated once a week. So you have to know what website to go to get the number if you're close to the line.
Well, good to have experts available, like the two of you. Okay, let's go to the next slide. What about the new federal court case that invalidated part of the FFCRA? Does that change anything for employers? Rob?
Yeah, so there have actually been a lot of court challenges, not only to the FFCRA, but to some of the New York rules that are out there in terms of 50-person gatherings and things like that. And there's a lot in the pipeline, but this particular case was New York State challenging the federal law on various points. We've already talked about the intermittent leave needing the employer to consent. That's been struck down. Some of the documentation requirements were struck down. There was an exception for healthcare providers. So the law said you don't have to give this leave, or you can exempt healthcare providers, which makes some sense because you don't want doctors and nurses taking leave when they need to take care of patients. But what the DOL said is anyone who works in a doctor's office or in a medical setting can be exempted. So that would mean an English professor at a college that has a medical school. I mean, so, you know, and the janitor in a hospital. And of course, those weren't the types of workers that you were trying to exempt to keep them working. So the court struck that down. And also there was a rule from the DOL that said if your employer doesn't have work for you, then you're not entitled to this leave. So if you're furloughed, or if the entire business was shut down, or if there was a layoff and you were laid off, you weren't entitled to this leave because it's leave from work. And if there was no work for you, you didn't get it. Now, interestingly, the court struck that down, saying there was not enough justification for it. So moving forward, it's probably going to be fought out whether someone on furlough or someone whose business has entirely shut down because of a quarantine order might still be entitled to paid leave. It doesn't make a lot of sense, and probably the DOL is going to redo its regulations on this, but for the time being, that's a scary proposition for employers to be completely shut down, but still subject to providing some leave for their employees.
Wow. Okay. Just a reminder to our audience, we have about 3 more questions in the queue, and I see we have about 7 of you have asked questions. So if you have any questions for the Q&A, please submit them now. Next slide, Kathy. Liz, this one's for you. Many of my employees do not want to come back to work in person, particularly those with underlying conditions or vulnerable relatives. Do I have to accommodate their requests?
You may have to, so it depends. So it's interesting, there are many employees who are saying, I love this working at home stuff, right? Some people love it, some people not so much. So you may have some resistance with people not wanting to come back. So what I do is direct them to their physician, because I don't want to be making those decisions. So what I say is I have an interactive conversation, and it's very important that you have that and use that language, because that will help to protect you if an employee ever comes back and says to you, you know, I wasn't treated fairly because of my underlying condition. So I basically ask employees, you know, please talk with your doctor. If he or she feels that you shouldn't be in the work environment based on an underlying condition, please bring a note. I would like, you know, to have an end date to it or a reevaluation date so we can talk about it. And that's really making, you know, a reasonable accommodation for that particular employee. So if someone comes back and has a doctor's note that says, you know, due to underlying whatever it might be, they don't even have to tell you what it is, but many times the notes will say underlying diabetes or an autoimmune disease or something like that. This person, I recommend that they telework. Certainly if you have telework available, allow that to happen. They may need to just be fully out of work. Interestingly, I received an unemployment claim back from the unemployment division. They've been swamped, as everybody knows, back in the beginning, right? Nobody could even get their claims filed. But we received a determination just this week that said that an employee who had an underlying condition was eligible for unemployment because they could not telework. Now, pre-COVID, they would not have been eligible because they weren't ready, willing, and able to work. Post-COVID, they were determined to be eligible. So I would say, yes, have an interactive conversation with that person, see if there's a doctor's note. Don't make the determination yourself, leave that in the doctor's hands.
Yeah, the worst thing to do with respect to any accommodation request, whether it's COVID related or just a disability related question, is to say no right away. a knee-jerk reaction. It's an inconvenience to even think about it. I get it. But employers get in trouble when they say, no, we don't have part-time work, we don't have light duty, and they don't think about it and they don't discuss it through this interactive process. Your defense to a failure to accommodate claim is principally based on the fact that you considered it and then made a decision instead of just making a decision. So what Liz says is right on, which is have a conversation, because sometimes it may not be what the employee wanted in the first instance, but it will be a workable solution for both of you. But if you don't have that conversation, you lose automatically if it escalates into a legal matter.
Very good advice. Okay, let's go to question 8, and this is for Liz. And really relates to what we were just talking about. How do I maintain our culture if my employees are working remotely?
For anyone who knows me, I'm all about culture. That is, I guess the number one thing I probably talk about all the time. And not just because it's a nice thing to have or the right thing to do, those things are important, but also because it helps you as a business owner make more money. If you have a great culture with fully engaged employees, you make more money. There's all kinds of studies out there. We do a full, half-day seminar about this. But I think during COVID, it's important to say, how can I maintain that culture if people are away from the office, or even we can't do the things we typically did because we're not supposed to be within 6 feet of each other and those types of things. So I think you have to really think it through. I have a client that does a retreat every year, and we still had the retreat this year, of course, socially distanced. And I typically do the opening kind of team building game. And it's usually like a fun, maybe physical game, and people are close together and collaborating as a team and producing some product. And then there's a little competition. Well, we couldn't do that this year. So I really thought about what could we do that still will help promote the culture. And it ended up being something I'm going to use with other clients even after COVID is done. So what everyone did is ahead of time, they submitted to me their favorite memory of that particular organization. What's your favorite memory of working here? And then I, took them all so that they were anonymous. We read them out loud and then guessed, like, who do you think wrote this? And some of them were so heartfelt that the business owner actually had tears in his eyes at one point and said, like, this means so much to me. And the answers really got at what their culture was. So I think it's really, you're able to do it. You just have to do it differently. We always have a picnic here at ESC. Greg, our founder and business owner, usually will cook for all of us. And we know sharing food is not a good idea during COVID. So instead, what we did is we ordered boxed lunches, maybe not as good as grilled food, but still was pretty darn good. It was Chevettas. And we, had a socially distanced, everybody brought their, garden chair in or their soccer chair and sat outside in the parking lot, and it was different, but it was still fun. So I think you have to consider it because this isn't going away anytime soon. People back in March were hoping, okay, 4 weeks and we'll be good. Well, we see that's not the case, and you can't let your culture deteriorate during this time. So I think it's very important, and I think high-performing companies do it really well, and they really focus on this. So I would suggest that if you're unsure how to do it, reach out to, you can reach out to me, reach out to an HR professional that you know, and they can help you with that.
Good, great. Next question. How do I handle employees that refuse to wear masks? Does the shield meet the requirements?
So yeah, this one was interesting to me because my initial thought was a shield can't possibly meet the requirement of a face mask because it doesn't, there's still a gap where respiratory droplets can get out. So I looked it up, and New York, in its wisdom, defines face covering, which is actually the phrase that they use. They require face coverings, and they define face coverings as cloth masks or N95s, and then they say face shields. So a face shield, presumably, according to those regulations, would meet the requirements of a face covering. Now, if an employee, if you're requiring face coverings in your workplace and an employee says, you know, I hate King Cuomo and I'm not going to wear a mask, which I hear all the time, then, you know, it's your rule and you can enforce your rule and discipline them or tell them to leave, just like any other rule you have. And hopefully people are becoming more used to having to wear a face covering when you go to a restaurant or when you go out shopping. And I think the resistance is getting less and less every day as people just get comfortable with it, just like seatbelts are, you know, just a habit now. But I'm old enough, unfortunately, to remember when that law went into effect and no one wanted to do it because it was the greatest oppression of humankind at the time.
Yeah.
But now it's just knee-jerk reaction. But I would say enforce your rules, and it's a serious health and safety issue, and you should take it that seriously and make the point with your employees that if they don't do it, it's jeopardizing their employment. We've made that very clear in our workplace. If you don't do the daily assessment that we require and comply with our rules, that you're jeopardizing your employment.
Very good. Question 10, Kathy. This I think is for Liz. Do employees still need to do daily checks?
Yes, absolutely they do. I think until we're told differently by the governor, we still need to do that. And remember, you can do all kinds of different things for your daily checks. I know some of you, I've had some client visits where I've got to walk through these machines that kind of take my temperature as I walk through, which are really sophisticated and pretty cool. Others are just using, you know, the forehead gun and doing temperature checks, but temperature checks can also be self-checks that you ask your employees to do at home before they come to work. But you want that daily checklist that asks a few questions. You know, do they have a dry cough? Now we've added, you know, have you lost your sense of taste and smell? Because that's something that I guess is more prevalent with COVID now. You know, are you having trouble breathing? You know, all those types of things. Have you been exposed to anyone? And you should ensure that your managers know what to do if you get a yes. And again, you have to have that conversation. I sat with one employee who said yes. And of course, we had our masks on and we're much more than 6 feet apart and had nothing to do with COVID. But she said, well, gee, I'm having some sinus surgery in a week or two and my sinuses are hurting and I didn't know if I needed to disclose that. So she was allowed to stay at work because she felt good enough to work. But you wouldn't know that unless you had the conversation with the employee. So all those things that we talked about, I think on the last webinar that I did, talking about things like having a safety plan. OSHA could come in at any point. Are they going to? Who knows? The DOL could come in. You need to show your safety plan, your safety policy, ensure that you have masks available and, you know, extra sanitizers and all the extra things that you're doing, I think are still very important. And we've gotten so used to them. Maybe sometimes people are getting a little bit lax because, oh, I forgot to do my daily check today because we're all fine, but you still do need to do those.
Yeah, and you know, the daily checks that say, have you had symptoms? Have you been in close contact? Have you traveled to one of these states? Those are easy question and answers. The temperature checks are complicated. Now, the temperature checks are not required by New York State, but it's highly suggested and recommended. The problem with them is they constitute a medical exam under the ADA, and so you have to think about confidentiality issues associated with the temperature checks. I know a lot of places that are doing this where right out in the open, there's a lineup and they gun the person's forehead or do the temperature check, and lights and alarms go off when someone is over 100.4 and they're separated out to do a perp walk to go somewhere else and get another test. And you've arguably just caused yourself a confidentiality problem. So you have to think about, I like the idea, if you're going to do temperature checks at all, to have the employees check their temperature at home and just answer the assessment that they've checked their temperature and they're under 100 and they're fine. That way you're not dealing with it in the workplace. Plus, if they did have a fever, they're not already there. So it's even better. They just don't come in if they have the temperature. But you got to think about, if you're going to do temperature checks at work, how are you going to do it in a way that protects the confidentiality of what I'll call a positive result. In other words, a high fever. Plus, New York State, interestingly, says you can't keep the results. You get pass fail, but you can't keep the results, which I think is a little screwy on their part. But you really need to, if you're already doing this out in the open and making it publicly available information, if someone has a fever, think about another way to do it, whether it's behind a curtain in a separate room, and think about who's taking the temperature and what PPE they're wearing. I mean, there's all of that kind of stuff wrapped up in it. And when you really think about all that stuff, I've got a lot of clients that say, well, if it's not required, I'm not going to do it, because I'm not sure a fever is the best indicator of COVID anyways. Some of these other symptoms are much more indicative of COVID, because a fever could be indicative of allergies and the flu and a cold and all kinds of other things. But if you're going to do it, just make sure you're doing it right.
Very good. So we have a lot of questions from the audience, which does not surprise me. It's a complicated topic. First one is, can the leave be intermittent for childcare between the two parents, and do they need to fill out a form and show proof this is needed due to COVID closures?
I would say yes. If there's two parents splitting it, it's tough if they're working for two different employers, right? But if they're both your employees, yes, you don't have to give them the time off at the same time. They can use it intermittently, one time one parent, next time another parent. And I would have them just put that in their explanation that, using this leave, sharing this responsibility for childcare with my significant other.
Okay, good. Can the intermittent leave be taken as a partial day?
Well, under the FMLA, the answer is yes. And this leave is technically FMLA leave. I'm trying to think back to the regs, whether they require a full day or not. I don't think they do. Liz, do you recall that?
I think it can be taken in partial days.
Yeah. And again, if we think of this as just another form of FMLA leave, that makes sense. Because if someone needs half a day off for dialysis or some doctor's appointment or something like that, that's intermittent FMLA leave. Plus, if you can get a half a day work out of someone, why wouldn't you, if that works?
Yeah, it's a thing. If you're very flexible with your employees, what you get back from them in most cases is even more. Now, some people say to me, well, I'm not getting that. Well, then maybe it's not the right employee to begin with. And that's a whole other conversation for us to have to talk about their performance. So nothing in COVID or FFCRA says we can't coach and develop people and give some constructive feedback to them. So don't forget about that either during this time. If someone's not giving you the performance you need, that has to be addressed. That is the key to everything to me. Giving feedback to employees and coaching on a regular basis just makes you a better leader. So I would say that be as flexible as you can, because your employees are typically very thankful, especially if they're highly engaged, high-performing employees.
Good. Here's another question. The company pays the 10 weeks leave, correct? And not an insurance company? Is there a cap amount of money that they receive per day in total?
Yeah, so it's 2/3 pay. The 10 weeks we're talking about is the FMLA leave because a child's daycare or school is closed. So that's 2/3 pay, up to my chart, $200 per day, and basically up to a total of $12,000 because it's actually 12 weeks total. The first 2 weeks is the FFCRA sick leave, and then the next 10 are the FFCRA FMLA leave.
And the employer does pay it, but there is a tax credit available for that afterwards. That's why keep the documentation, again, not too much documentation where you're putting an undue pressure on the employee, because that can be a different issue, but enough so that if the IRS comes back and says, why are you asking for this tax credit, that you have that documentation.
Great. For intermittent FMLA, are we able to state the employee can only take leave only in daily increments, or can they take leave in any increments they want to? I think we just answered that, right?
Right.
Have to, okay. The FMLA for COVID-19 qualifying documents don't ask any questions about other parents working from home, or if there's a partial custody agreement in place, only needing to care for child part-time. How can we fairly ask these questions if we know about the personal situations if it's not required by FMLA?
Well, that's interesting. First of all, FMLA has its certification requirements, and you can only ask certain questions for someone taking FMLA leave for any reason. And so you have to be careful about how much you delve into someone's personal situation.
Yeah.
You know, it's very difficult to say, you know, are you sure you need time off to take care of your child? Like, I take care of 3 kids and find a way still to work. Why can't you? I mean, the optics of that and the comfort level of that conversation is difficult. So I would be careful about how many questions you ask and going beyond anything that the Department of Labor has said is appropriate. You can ask for, obviously, the name of the child and the school and what the schedule is, but to question whether someone actually needs to take care of their child or not is, you know, are you really going to get an answer to that anyways that's satisfactory?
Yeah, I think that goes back to what is your relationship with that employee, and are they having that, do they have a good relationship with you and they're having a transparent conversation? Because typically the employee will say, I need this now because my spouse is now working, or they will in the conversation say it. You're not necessarily going to document that on the form that they said their spouse is working, but they could say that even if their spouse isn't working. But it all goes down to, you know, do you have trust in your employees? What kind of employees have you hired? What is your relationship like? Now, I realize everybody has somebody who's going to, you know, perhaps try to work the system. But I think if you have an open conversation with that person as you're talking to them about their leave, without crossing the line, a lot of times they just tell you the information without you even asking it directly. At least that's what I found in the conversations I've had with our clients' employees. They've been very open about, here's what's happening, and most employees really want to be able to work it out so someone else can help care for their children, sometimes a parent, that type of thing. But it'll depend on the person's individual situation. Some parents are isolating themselves because you know, they're afraid of COVID themselves. So their parents not coming to help with childcare, even though they did in the past, and they can use leave for that.
I would also think a full explanation of how all of this works is helpful to the employee, because it's not unlimited. There's some restrictions. I think it's super confusing for people to understand. That probably helps with the transparency and the situation. So good.
Liz, you're absolutely right, because I have said to some people, this leave doesn't allow 2 parents to be home at the same time. So I'm not asking anything, I'm just making a statement, and then they'll usually say, oh, let me explain. I'm not writing that information down, but a lot of times they will share it.
Yeah. And the school year is long. It's a long school year. There's restrictions on the availability of these benefits, so people need to know the details, both sides, so they can really plan accordingly. So good. This is an interesting question. If an if an individual visits an employee in New York from a restricted state, does the employee have to quarantine for any period of time?
Not unless the person was ill or exhibiting symptoms, but not just because somebody came to visit.
Okay.
Yeah, now that person who comes to visit is supposed to quarantine for the 14 days in New York, which means they shouldn't be shacking up with someone else or, sitting next to them on the couch or something like that. But we know people don't necessarily do everything they're required to do. But unless there's symptoms or a positive test, close personal contact with a confirmed or suspected case, there's nothing that says the employee can't come to work or anything like that. It's sort of like that indirect case where there's no direct connection there to any suspected or confirmed case. It's just someone who's under an order to quarantine for 14 days. You happen to come into contact with them for some reason or are near them. That doesn't mean anything for you at that point.
Okay, good. Here is a very complicated question. An employee who is advised by their specialist that they are not cleared to return to work due to a compromised health situation is out of work through the end of the year. Telework is not available. Their insurance broker, the employer's insurance broker, advised that this would be disability. The doctor is refusing to complete disability paperwork.
I would have the person apply for unemployment, and that's the example that I gave earlier that we saw one come in like that this week where the person was found eligible for unemployment. Even though they're not ready, willing, and able to work, they were still found eligible due to the COVID situation. I think you can't make a physician fill out disability papers. And if the person really just has an underlying condition and can do other work and they're not disabled from doing any type of job, perhaps the physician can't write that note. So I would turn to unemployment in this case.
Okay.
Yeah, I mean, it certainly would qualify for disability, but there's difficulty in getting someone to make that application if they don't want to, although they might actually be better off on disability than on unemployment now that the extra money is no longer available on unemployment. I don't know how the maximums work for any particular employee. It depends on their salary. The other question we're getting, which is similar to that, is not that the employee themselves has a compromised condition, but that someone in their household or someone that they take care of has a compromised condition. So I can't come to work because I help take care of my mother who has a compromised condition. And then that gets interesting. It's not someone who's been quarantined. It's not someone who's been told to isolate. So none of the federal FFCRA leave applies, but they just don't feel comfortable coming to work because they don't want to create exposure for a relative. But that's not a reasonable accommodation situation either, because your employee is not disabled. They just have a relationship with someone who's got a disabling condition. So there's no legal requirement to even accommodate them for that. Now, do you want to say no to an employee who is worried about a family member? Probably not. So you should try to work it out, but it is a different scenario, and there's different or some non-existent obligations than if your employee themselves had a condition.
Yeah, we actually had a couple of those in two different cases. One being the person actually wasn't just afraid because they were taking care of a relative, an older relative, but they had to give some care to that relative. So even previous to COVID, there's New York State PFL that they may be eligible for. So that's something, you talk to an employee who says, I have a concern with working and I need some help, and you have to go through all these leaves in your mind of what are they eligible for. So you want to also look at PFL and see if they're eligible for that. But if it's just the fear, then Rob's right. Do you really want to say no? It depends on the circumstances. I realize you have to run your business. But if you get creative, sometimes you can do both, make the employee happy and have it be a win for the business.
Good, good. Rob, you'd mentioned the tracking situation with temperature checks. This is a great question. How do you perform tracking, or how do you perform tracking if you don't keep results? So if you're not allowed to keep those, what do you do?
Well, what you're not allowed to keep are, I had a 99.4 and someone else had 100.8. The actual results, you can keep the information that the person passed the check and was allowed to work. And then knowing that they were there at work that day, you can then, that helps you trace if you do get a positive test down the road. So it's just the actual results that you're not allowed to keep, which I think that's kind of overkill on the part of the Department of Health, because if you can take the temperature and see it, why shouldn't you be able to keep a record of what you did? But they basically say you can keep the pass fail, you just can't keep the actual result.
Okay.
And a lot of HR professionals have turned into, they joke about, I've turned into a nurse now, or a medical aide, because I'm, instead of doing my job of what I typically do, I'm spending all this time taking everybody's temperature. And if you have shift work, it ends up being a lot of time. And as Rob mentioned, you have to be careful about what PPE that person's wearing. So I really like the idea of self checks at home before you come to work.
Even if you have to buy thermometers to give to some employees so they can do the check at home, although a lot of people have some kind of functioning thermometer available, but it's maybe cheaper to supply a thermometer to employees than to dedicate someone to be there at clock in time to gun 30 employees and to keep those records. I think it's much easier, if you're even going to do temperature checks at all, to make it a self-check at home and just have the person certify on their way in, as they have to do with other questions, that I took my temperature this morning and I'm less than 100.4, or whatever your level is that you've selected.
Okay. Here's our last question. It's a follow-up to a question we asked earlier. In the beginning, Liz, you had stated that if someone reports that both parents are home, a company can deny leave. And this relates to the question that a woman asked about the whole, well, I'll read the question again. The question related to qualifying documents that don't ask any questions about parents working from home. So can an employer deny that, if deny the leave if they know both parents are there?
Well, they can if the employee tells you, yes, both parents are home. If the employee's being dishonest about it and saying, no, I'm really the only one home, but you think the other parent's home, you wouldn't be able to deny based on that. But when you're explaining, here is what FFCRA is and some of the parameters of it, and one of the points of it is that two parents can't be at home. If there is someone else taking care of the child at home, be it a parent or a grandparent or any kind of caregiver, then FFCRA should not be approved. So, but you need an honest employee to be able to tell you that. But I ask that question. I don't ask them to document it, but I guess I don't ask the question. I tell them that that's part of the leave, and then hopefully they say, oh, well, I guess I'm not going to be eligible. My spouse is using it too. Most employees I've talked with just come to me with all the facts though. My spouse is at home. He or she's going to do this part-time. I want to do it part-time. I want to make it work. I love my job. I want to figure out a way to make it a win-win for everyone.
And just because both parents are home, does not necessarily mean they're both available to take care of the children at the same time. One person might be home, but required to remote work by their employer. So
Sure.
Just because both are home, you can't make the snap judgment that I'm not going to give you the leave because clearly your spouse can do it.
It's someone else available to care for that child is really the question that you need to ask, and that you can ask directly.
Very good. Well, no doubt we're headed into a very interesting and busy fall season for everybody. I want to thank you, Liz. Appreciate your expertise. And I want to thank you, Rob. We also appreciate what you have brought to the table here. Thank you to our audience, and visit our website, thepartnership.org, and have a great day.
Thank you.
Thank
Thank
you.
you.